Good afternoon. It's Dr. Jim McCarty and Neil Revlett. And Neil, if you don't mind just telling me how I've made a difference in your life. You were telling me about your knee.
Yeah, so about a year and a half ago, I've never had knee problems, never had leg problems, always really strong. 44 years old, kind of had a freak basketball accident, meniscus went off to the side, pretty much kind of ripped up everything in my right knee. Never went to the doctor, I never went and got surgery to get it fixed. I just kind of let it heal on its own. And really it was
And when was that?
that was about a year and a half ago.
Okay.
So I kind of let it heal on its own, which I think was the best medicine for it, since I didn't have to get back out on the court or anything like that. But it still didn't feel right. It just wasn't 100%. And
How much would you say that you think it was interfering with your activities, your sports, everyday walking?
I mean, as far as walking, I was fine.
Okay.
But I didn't feel comfortable like really going on it like
Okay.
100%, like doing sprints or running stairs or
Right.
definitely lateral cuts or any kind of movements like that, jab steps, things like that. I just didn't feel confident in it. I felt like if I do a jab step, it's probably gonna
Blow
go
it
out
out.
on me again.
Yep.
Um,
And then what happened? You came with your boys and we were doing some physical exams for high school sports.
yes, sir.
And then you asked me if I'd just take a look at your knee. And that was what, a week ago?
That
roughly?
was about a week to a week and a half ago.
Okay.
And so he kind of took a look at my knee. I said, "Hey, look at it. Can you tell me if I still have tendons that are am I healed up appropriately where I'm okay to kind of move forward and try to do some of
Right.
the things I used to do?" He ran some tests on me, and he kind of came to the conclusion that my tendons were healed, but the signal between my tendons and muscles and fibers were not necessarily synced 100% with my brain.
Yep.
So
I needed to reset the direction the muscles were pulling on your knee so that it wasn't pulling off to the side.
right. So basically, he can get into the more detailed chiropractic work that he did, and I don't even know if it's necessarily chiropractic work per se, because most chiropractors do not know how to do what he did. But basically, he was just the funniest thing. He's pushing on my neck, he's pushing on my psoas muscles, he's pushing on and my thigh, and then down even towards my Achilles tendon. And the funny thing was, after that happened, for any of you that drink, it kind of feels like you've had a couple too many drinks, but you don't have the head buzz, right? So you're kind of almost having to learn how to re-walk, in a sense, like really steadying your pace on where do I need to step next, how do I need to step. He told me, probably take a day to 2 days. He was right on the money on that. It took about a day and a half. And everything kind of went back to normal, and I really felt like I had more stability in my leg. Literally probably 2 to 3 days after that, I started doing high school workouts with some boys, 2 days for football, and I'm out there running with those youngsters just like I did when I was 20. So, as far as I'm concerned, except my muscles are sore because I haven't used them in, a year or so. But other than that, I feel very confident in my leg. I don't feel like there's going to be any issues with me, demonstrating moves or doing anything I need to out there on the field with those guys. So I'm very pleased with the results, and it was a fairly simple process.
Great. I'm happy for you.
Thank you, Dr. McCarty.